What's up, guys? So, I'm sitting here in my Stony Brook t-shirt and a girly blanket because I want to do a post that I meant to do a long time ago. Well, I was going to do it, but I was uncomfortable, if I'm being honest. Um, I have never shown my legs to anyone. Nubs, legs, stubs, whatever. Residual limbs, whatever you want to call it. I was just uncomfortable. I didn't even like looking at them for a while. But I'm comfortable now. I don't care. And but I realized I've never shown anyone, not even my own kids. My wife has seen it, of course. She's seen everything. She's seen too much. But I just want to show something really quick to my newer amputees and some of my older amputees and people that are just curious. Like I said, better show. Here are the legs. I Again, I've never done this, so I figured I might as well show 10,000 of my closest friends and some strangers. But so here they are. There they go. To show you really quick. Well, let me tell you. What I want to show you or talk to you really quick about is the importance of moisturizing your legs. It is insanely important. There are certain things you just shouldn't do and can't do after you become an amputee. It's not, like, for one, it's not recommended that you shave your legs. The skin on your residual limbs changes because it's covered by, it's silicone, but it's a special blend. Just think of a thick silicone, and I'll show you in a second, that goes around your leg all day if you're wearing your leg all day. And it's not something you can get away from. You have to wear it in order to put on your leg. So your skin becomes more sensitive than it had ever been. So ingrown hairs, all of those things can cause an infection, which can eventually, possibly, cause another amputation going higher up. That's not what you want. So lotion. There are lotions specially for amputees. Reason being, irregular lotion leaves residue, and it kind of leaves a film, a slimy film, or if it's just too moisturized, and then you put your liner on and get in your leg, it causes movement. Any movement in that liner is terrible. It causes blisters, which is what you do not want. Blisters hurt. We're not talking about a blister that you got, in the past, that were a little annoying. They hurt. Not just because, they're bigger and they're in a sensitive place, but because when you get back in your leg, now you're putting all your weight on that blister, which opens it up more. So if you end up getting a blister, you should probably relax, which I did not do for a long time, and pay the price for it. But I ended up with a blister on this one. You can't really see it because it's healing, but it went all around my leg, from by my knee on both sides, all the way around. Now it's just, I don't know if you can see it, but the skin is, it's chapped and peeling, and I'm gonna put lotion on that. And you have other things like on this leg. You can see down here. Here, it opened up recently, which is why I've been off my leg, this leg, and why I haven't been walking at all, because I cannot get my leg on at all. I have what they call a bony prominence, which is the bone that sticks out too far here. And when I put that in the leg, it scrapes and the leg opens up. We're not talking a blister, we're talking about the leg opening up. Now, I don't have much meat on my legs, my residual limbs at all. So it's a problem, and it's been a problem. So working on that, it's getting better, it's healing, slowly but surely. But I ended up getting a diabetic lotion. I don't know if you can see this. It's, I'm not a sponsor, I just use it. The reason I use it is because it's very good, and it leaves no film at all. Like, once you put it on, your leg is moisturized, but when you rub your hand on your leg, you can't even tell really that that lotion has just been put on, I should say. It's great. expensive, but it's great. So that's it for that. So what I end up doing is after a shower, obviously, put the lotion on. During the winter, your legs dry out a little more. So I'll put it on more often in the winter and in the colder weather. But that's it. I just put it on like normal, and I give it a second afterwards. I don't even have to, but I just do. A little weird in that way. But that's it. And because I'm a bilateral amputee now, I have to do it to both sides, obviously. And I was told not to over moisturize the very bottom down here, like that kind of, it looks like I'm doing it, but I'm not. I'm not going over the bottom. I'll do the sides and I'll do up here. But this part of your leg kind of becomes your new heel. And if you think about your heel on your foot, it's tougher than the rest for a reason. That's what you need here, because you're putting all your weight on that all the time, and it's sensitive, and it still gets sensitive. That's just what happens, because that's not what that part of your leg was made for. So give and take. You have to deal with these things. But that's it. I put that on, done. And this is at least once, twice a day. Twice a day for me is better, especially in the winter. During the summer, that's not a problem. You kind of have the opposite problem during the summer because you sweat. And if you're not an amputee, you may think I'm exaggerating, but you sweat to the point where you pour sweat out of your liner. It's intense. But again, just one of those things. So after I'm moisturized up, this is the liner right here. It's got a pin at the bottom because I have a pin lock system where it locks in to the socket, stop it from pulling out, which some of them can do. Before this, I had a suction, a liner suction, which is another liner. So you would put a liner on like this, and then you fold it down. And you have another liner on the leg that comes up, sticks to here, and that's what causes the vacuum to keep the leg on. It was good, but when you sweat, it would start to pull out a little bit, and you end up having to push back down. Not a big deal, but I don't have to deal with that with this. This locks in at the bottom, you hear the click, goes into the bottom of the socket, and you're good. So the inside of this liner that is in contact with your skin all day is this. It may not look that thick, but it's pretty thick, and it is tight, like wetsuit tight, tighter than wetsuit tight, which it needs to be, because you don't need any movement in that leg. One, you want your prosthetic to feel like it's part of you, and the only way it can is if there's no movement, and the only way that can happen is if the fit. If you shoot guns, you think about your aim starts at the grip. You don't have a good grip, you don't have a shot. You don't have good suction, you don't have a leg really, because you can't move around the way you need to. And again, the blisters come in and everything else. It's a chain effect. There's a lot that ends up going on. So I just turn this inside out every day. And yes, every day when I take it off, I do end up turning it back inside out. I was told to. I don't. It's supposed to preserve it, and these are very expensive, so I will be preserving it. You roll this on, just like this, all the way up, and I end up putting on a sock. This sock is to fill in volume in your socket, to stop any movement. These are what they call a mill. This is one mill, one ply. One ply. They have 1 ply, they have 3 ply, which is 3 of these in thickness, and they have 5 ply, which is 5 of these in thickness. depending on how much volume you lose on your leg, during the day, you end up having to put on a sock. Because it gets to a point where you can't even move if you don't have, if you're too small in your socket, meaning you have too much room in your legs while, shaking around. If your leg is shaking around, then it's shaking on this carbon fiber socket right here, which does not give at all, and it doesn't feel good when your leg is rubbing on it. Just to show you the pin lock system, that pin that I was telling you about, I put my leg in, that hole in there, it clicks and locks in there and holds it in. It is not coming off. Great. This is the Philhour All Pro XTS 8-inch in height, which is because it gives it more flex. I shouldn't be doing that. Oh, yes it is. It gives it more flex. I don't know if you can see it, but I can feel it. And as you're walking, running, the return, because you don't have an ankle, helps. Take a step, and it kind of doesn't spring. Because when I think of spring, I think of pogo, and it doesn't do that. But it's trying to make up for the fact that you don't have an ankle to help you propel yourself forward. There's no leaning when it comes to that. So that's what it does. After I put this sock on, this is the final part. Put this on, and what it does is when I put my leg in the socket, this little rubber part right here is the final seal, and that helps me stay in. And that's it. I do this ×2, and I go about my business. Really all of the time, I have this on, even when I'm not wearing my leg. If I don't put it on for the day, I don't have it on, but when I'm sitting down or I'm laying down, I don't wear my leg. It's horribly uncomfortable, so I take the leg off. So I don't take this off because I don't want to go through all that again. Now if I want to do it, I just put my legs in and I go. It's less, less of a step. But that really is it. And I just want to make sure you guys really understand the importance of moisturizing your legs. I didn't listen at first, and it caused a lot of problems, a lot. What I showed you on this leg, may not seem like much, right now because it's closed, but when I say it hurt, it hurt. And doing anything in that leg was just impossible. You don't want to go through that, because in those moments, it slows you down, brings you down. It's going to happen naturally anyway, and it's something that we have to go with the flow. And we don't want to cause anything we don't have to deal with for obvious reasons. We want to keep moving. Yeah, it's about moving, getting up, amp up, right? And so really, that's it. And I'll be posting another video about the legs, because I saw some people asking, what kind of legs should I get? What's the difference? Big difference. I have my old leg. I'll show you that, and I'll show you the difference in what they do. I love this leg right here. I will be getting a running blade when I'm ready. I guess I should walk first. But that's it. That's it. And talk to you guys soon, and amp up.